Turning back now to the pandemic, we're joined by New Jersey Governor Phil Murphy. Governor Murphy, good morning. We've been talking about the national picture in terms of COVID-19 this morning. Records set in terms of deaths, hospitalizations, and cases generally. What does it look like in the state of New Jersey right now? Of course, when we go way back to March, it was New York and New Jersey, in the area we both live in, that was sort of at the front of this terrible curve.
Yeah, good to be with you, Willie. We're back in it in a big way. There's just no other way to put it. I have a lot of optimism if we roll the clock forward to sort of March, April, May. And there's a lot of reasons for that, but vaccines are a big part of that. But I think we're in for a brutal 2 or 3 months. People have gone indoors. We're in the holiday season, enormous pandemic fatigue, a lot of transmission in private settings. So no matter how good you are at enforcing your rules of the road, we can't get into everybody's living room. It's a combination of a lot of lethal realities. The good news is we know a lot more. We have a lot more capacities. It certainly is hitting a younger, healthier demographic. That's not to say our seniors and folks with comorbidities are still not highly exposed. They are. So there's some amount of, especially in our understanding of the virus, there's some amount of near-term positives, but the next 2 or 3 months, I think, are going to be brutal. And I think we've got light at the end of the tunnel after that.
Governor, what's going on in New Jersey's hospitals right now? We're getting reports from across the country of ICUs and ERs overrun with patients, and concerns that, unlike back in March and April, a state like New Jersey can't call in doctors, nurses, healthcare professionals from other states because they now are managing their own crises.
Yeah, that last point, Willie, is right on the money. That's the one capacity that I worry about, that we worry about. You're absolutely right. When we were on fire in the spring with New York in our region, we could call folks in from the bullpen from around the country, in some cases from around the world. That's not an option right now. Better news, our hospitalizations are way up. They're probably 3,500 beds today. Our peak, though, was at 8,300 in the spring. Please God, we don't hit that. We don't hit that. And we're watching that obviously very closely. Our ICU beds are a subset of that. I think we have the capacities as it relates to beds, PPE, ventilators. I do worry about healthcare workers. They've got enormous, for lack of a better word, PTSD from this. Who could blame them for the fatigue and mental health challenges they have? And the bullpen is short relative to where it was in the spring.
Governor Kasie Hunt's here with a question for you, Case.
Hey, Casey.
Governor, good morning. It's good to see you. You mentioned that this is a lot about private homes, but we are seeing some states put new restrictions in. California, in particular, has gone back to an earlier phase and is locking down some establishments. Do you feel like you may need to do more in New Jersey between now and the holidays to try and combat this, more lockdown restriction type measures?
Yeah, I mean, Casey, everything has to be on the table. I'd be abrogating my responsibility if we didn't have every option on the table. And where we've seen transmission, we've surgically attacked it. I'll give you an example. We saw restaurants late at night sort of morphing into clubs. We saw a lot of bar seating lead to transmission. So we've cut indoor dining at 10, we've cut out bar seatings. Those are the sort of steps that I believe that we'll continue to take. We don't have a wholesale evidence that just because you're indoors in a given environment, indoor entertainment, gym, a restaurant, that's necessarily, your risk has gone up, but we knew that all along. But is it beyond that manageable risk? We don't see that yet. But all options, I have to say, remain on the table.
All right, New Jersey Governor Phil Murphy, thank you very much.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.